Blood glucose levels and its association with duration of recovery in tropical acute febrile illness among hospitalized patients. Good morning everyone, myself Dr. Rishitesh Reddy Mugala, postgraduate in the Department of General Medicine at Kasturba Medical College, Mangalore. And this study was done under the guidance of Dr. Venugopal sir. So as you all know, tropical acute febrile illness is defined as all acute febrile syndromes with oral temperature above 37.5 degrees Celsius in the last 24 hours and less than 2 weeks. And with non-specific symptoms like fever, nausea, vomiting, it is commonly encountered in tropical countries like the South Asian countries like India, where we witness a febrile illness during and post monsoon seasons. Epidemics of acute febrile illness are major concerns and a common reason to seek medical advice care in India. So tropical acute febrile illness, TAFI, causes release of hormones that fight infections. These hormones can in turn also cause increase in the blood glucose levels. It is interesting that people with stress-induced hyperglycemia are in turn associated with increased risk compared to the patients with diabetes. In low and middle income nations, febrile illness is the leading cause of morbidity and mortality among children and also in adults. TAFI is due to infections like malaria, dengue, typhoid, chikungunya, leptospirosis and many others that we see in these tropical areas. With seasonal heterogeneity due to geographical location, recurrence of infections are common in India. So we observed a knowledge gap here between the blood glucose levels and its association with duration of recovery among the patients with acute febrile illness. So it was a prospective observational study conducted in a hospital from April 2023 to October 2024. A sample size of 74 was calculated. Study was approved by the Institutional Ethics Committee and all patients with acute febrile illness were approached and they were briefed about the study. And after obtaining informed consent, according to the proforma displayed, their demographic details, signs and symptoms, comorbidities, vital parameters, examination findings, complications and the duration of hospital stay were recorded in the structured format. So participants were categorized into those with hyperglycemia and euglycemia. This is based on the table given here, with fasting blood glucose of more than 110 mg per deciliter, postprandial blood sugars of more than 140 mg per deciliter and random blood sugars of more than 200 mg per deciliter and HbA1c of more than 5.7 were taken as hyperglycemics and the others were considered as euglycemics. The duration of hospital stay was recorded in the proforma. An analysis was done using the statistical package for social science and p-value of less than 0.05 was chosen as the criteria for significance for the study. So it was found that 58% of the participants were euglycemic, whereas 42% of the participants were hyperglycemic. And duration of hospital stay was 2 to 5 days in around 62% of the patients and more than 5 days among 38% of the patients. In euglycemic patients, 86% recovered within 2 to 5 days, whereas 14% required more than 5 days for recovery. And in hyperglycemic group, 71% required more than 5 days to recover compared to 29% which recovered in 2 to 5 days. So therefore, an association between the increased blood glucose levels and longer duration of hospital stay was observed with a p-value of 0.001. Other secondary outcomes that we saw was there was a longer duration of hospital stay in patients with hypotension with p-value of 0.043 and with presence of bilateral crepitations with a p-value of 0.023 and the patients with increased creatinine also had a longer duration of hospital stay with 0.026 was the p-value. Acute hepatitis was the most common complication that we saw in these patients, but there was no association with that. So the primary crux of the present research was to focus on the association between the hyperglycemia and the length of the hospital stay in patients with fever in tropical country like ours. It is found that longer hospital stay is significantly associated with hyperglycemia, hypotension, acute pulmonary edema and acute kidney injury. Hyperglycemia group include patients with stress hyperglycemia, uncontrolled sugars, poor compliance to oral hypoglycemic drugs, presenting with high blood sugars. With the euglycemic group include all patients with the sugars in the normal range. So stress hyperglycemia is a transient elevation in the blood glucose levels during an acute episode of physiological stress. This causes increase in release of the counter-regulatory hormones, which in turn causes change in the endocrine secretions and peripheral insulin resistance, which alters the normal glucose metabolism leading to hyperglycemia. In the present study, the primary etiology for tropical acute febrile illness was found to be dengue fever, followed by undifferentiated fever. But dengue fever is associated with shorter duration of hospitalization, but patients with enteric fever required longer duration of stay. To summarize my findings, hyperglycemia was observed in 42% of the patients admitted with tropical acute febrile illness. It highlights the importance of monitoring the blood sugar levels for the patients with tropical acute febrile illness at the time of admission. So among these patients with longer hospitalization, 71% were hyperglycemic and 29% were euglycemic. This again re-emphasizes the importance of blood sugar monitoring in patients with acute febrile illness to counsel regarding the prognostication of the patient. And from the parameters of the study, it can be concluded that hyperglycemia was associated with a longer hospital stay. The secondary outcomes that we had seen were these patients with longer duration of hospital stay also had complications like hypotension, acute pulmonary edema and acute kidney injury. And it is noteworthy that majority of the patients, more than 55% of them, did not experience any complication during the hospital stay. The limitations of the study would be that it was a single center study, so therefore the results may not be generalized, and also sample size of 74 may limit the application of a study. Thank you.
In this study,
Yes,
did you exclude patient with diabetes, or you just included all the patient with acute febrile illness in the?
We included all the patients irrespective of their diabetes status, sir. Even if they had uncontrolled sugars or if they're not compliant with the medications also, we included them in the hyperglycemic group if the sugars were high, and in euglycemic group, the sugars were in the normal.
One question is, it's a well-known fact, so diabetes, uncontrolled hyperglycemia itself is a factor for prolonged hospitalization due to its comorbidity. So if you're specifically looking to see the impact of hyperglycemia, is it good to exclude such patient in the study design, so that it will give you a better clear picture on that?
Yes, sir. But what we had done was we were including those with stress hyperglycemia and any patient with high sugars, because at the time of presentation in the hospital, at the time of admission, we wanted to know that with high sugars, what is the duration of stay that they are requiring in the hospital, so that we can counseling regarding the prognosis, because many of the patients that we come across, their first questions in the casualty or anywhere during the admission would be the duration of the stay that they would require. So on those aspects we thought and we took it into consideration.
Why did you take HbA1c as a criteria here? Is it needed to see the hyperglycemia in acute illness? Because is it a recommendation to look for HbA1c in such patient?
Not exactly, sir. That we have taken any one of it being above the normal range.
That's true, but is it really mandatory to put HbA1c
not really, sir.
here? Because
the blood sugars would be more
stress
reliable.
hyperglycemia, it could be normal. So is it really?
Yes, it was not exactly indicated, but the only point was to further follow up the patient and work upon them if they are diabetics or not, and that is outside the study we had planned for the patients.
Did you correlate the outcome of these patients with the glucose levels? Any correlation?
Yes, sir. We had correlated the outcomes, but it was not significant, sir. The association between the comorbidities and the blood sugar levels.
Any difference in patient after excluding? Did you analyze the patients? Any difference in the glucose level and outcome in patients who are not diabetic?
We had not taken it separately, sir. We took it as a single group and we compared it.
Okay.
I think some of the questions have been asked. One, you had just put a line that in endemic fever there was a longer hospital stay compared to dengue.
Yes.
So do you think that won't the two things, one is the primary illness of the patient will itself decide the hospital stay, not only hyperglycemia?
Yes, sir.
And do you think that hospital stay is a very subjective matter, like one physician can decide how many days the patient stays, another physician decides to discharge early? So isn't there a very subjective component to the sort of hospital stay, or do you have a specific criteria that 2 days after fever resolves you will discharge or something like that?
Yes, actually this was one of the matter of our concerns when we thought about the study, but then we had thought that it is individualized from physician to physician, but also to generalize it in a way, then we wanted to see that what is the duration of stay, like is it, if they are having complications like pulmonary edema or AKI, they are requiring longer stay, and there were not enough of studies that we had found in this aspect comparing the acute febrile illness with the complications of hyperglycemia. So we thought of going ahead with this.
So do you think is a cause and effect between hyperglycemia and hospital stay in acute illness?
Yes, sir.
Is there a cause and effect relationship?
So that is because I thought maybe the infection itself is causing the inflammation, and that is thereby increasing the.
So we are not able to you are not able to give a cause and effect relationship.
Yes, sir. Isn't the actually there is a huge lacuna, sir, in this aspect, and there are very limited studies that are done, so we can.
Good.
Yeah, my comment would be you should have maybe segregated the cases, if you say stress hyperglycemia, non-diabetic individuals developing high sugars, at least with history. Secondly, has the primary illness something got to do with the, like dengue fever can cause islet cell dysfunction?
We had checked for that association, ma'am, but we didn't find it to be significant.
Between the
Between
underlying the
dengue
cause
fever,
and
malaria, or strep typhus, we had seen leptospirosis. There was no association
and
between.
Did you segregate them into severity of illness? As you say, some of them developed pulmonary edema, some were just having fever. So, did the severity of illness also correlate with the sugar values and the outcome?
We had not done the association between the type of the presentation or the severity with the.
Because hospital stay is a very not a very reliable thing, as you said. Different physicians may choose.
Yes,
Severity of the disease. Did you have any model to say mild, moderate, severe?
We had not categorized like that, ma'am. We had just seen that the complications that we had come across, that we had seen in that acute hepatitis was one of the most common complications seen in 26% of the patients. Other complications like postural hypotension and all we had seen, but they didn't have any association. We only found the association between the febrile illness and pulmonary edema, which had severity requiring longer duration of the hospital stay.